Hello, this is Dr. Ned Halliwell, and welcome to Distraction. I am very excited to tell you we have reached a special milestone. We have now had 1 million downloads. When we started, I didn't know if we'd get 10 downloads. Well, we've now had, thanks to all of you, 1 million downloads. You know, in the world of podcasts, there are so many podcasts. Most don't get this far, and thanks to you, we have. We want to say thank you. I am honestly tickled, and it really is a testament to our production company, to our wonderful producer, Sarah Girton, to Barry Berman, who really had the idea of doing this, and all of you for showing your support and enthusiasm, and I have many happy memories of. I drive down from my home in Arlington to the studio just outside of New Haven, and it's a 2.5-hour drive both ways. And what makes it worth the 5 hours on these Mondays is the fun I get in talking to all of you. And the episodes that stick out in my mind, well, of course, the ones that my wife was on, and all three of my children, actually. And then the wonderful guests, Kristin Seymour was particularly terrific, and her wonderful kid that she worked with, Harry, and so many others, my friend Michael Thompson and John Rady. Wonderful experts. We had Dr. Oz on, and just many, many guests who have made the show memorable, very generous with their time. But most of all, it's you and the whole notion of creating a community that's connected and trying to build that groundswell of connection and working together, creating positive energy. Which, is really what we're all about. Spreading information that will build bridges of understanding, knowledge, and with that comes the positive energy of connection. There have been funny moments when I lost my place altogether, didn't quite know what was going on, and Sarah would bail me out, or the guest would bail me out. And I don't think listeners even noticed, which is wonderful. And you listeners, you would have bailed me out anyway. We've had fun together. The show's really, I can't believe we've been doing it now for 2 years. And we're going to head into our third season, which is really terrific. So to celebrate the milestone, we're going to give away 3 copies of my new book, which is unlike any book I've written before. It's a memoir called Because I Come from a Crazy Family, The Making of a Psychiatrist. A friend said to me, doesn't everyone come from a crazy family? And I guess that's true. But I write about my own crazy family. And it's not about ADD at all. It's about my early childhood and then my early training in psychiatry. And then one listener will also win a 30-minute telephone conversation with me. I hope that turns out to be a prize and not a booby prize. But in any case, you'll be able to talk to me on the telephone for 30 minutes. And you can hang up sooner if you want to. But I'll stay on for 30 minutes if you want to keep talking. And keep listening to the end of the episode to hear how to enter that contest for 3 copies of my memoir and the chance to spend 30 minutes on the telephone with me. I'm pretty good in conversation, and I promise to at least make you laugh. Well, we figured a great way to celebrate reaching 1 million downloads would be to answer some of your questions. And remember, if you have a question for me, you can always send it to connect@distractionpodcast.com. That's connect@distractionpodcast.com. So our producer, the wonderful, estimable, dedicated, hardworking, never let you down, Sarah Girton, is with me in the studio now. She's not usually sitting across from me, but she is now. And she's got a stack of questions that we've received from you all, our listeners.
So, Sarah, shall we go ahead and jump in?
Yes, we should. And thank you for reading all those nice words that I wrote. No. No, thank you for saying those nice things. I appreciate that. And thank you again. I want to say thank you to our listeners as well, because it is amazing to get 1 million downloads. So that's really great. And we have lots of questions, and we keep getting more questions all the time. So our first one comes from a woman named Danielle. And she writes, I'm a 21-year-old college student and was finally diagnosed with ADHD about a month ago. The Distraction Podcast has been incredibly enlightening and reassuring. Thank you for sharing your knowledge and experience. I've also dealt with OCD ever since I was a little kid, and the symptoms of the two disorders seem to overlap a lot, especially regarding executive function impairment. I did some research, and the common theme I saw was this. ADHD is linked to brain hypoactivity, but OCD is linked to brain hyperactivity. Needless to say, I'm confused. How can a brain be hypoactive and hyperactive at the same time, and how on earth can someone with OCD and ADHD figure out a medication regimen that manages both without making one or the other worse?
Well, I wouldn't worry about hypo and hyper brain activity. Just look at the symptoms and address those. So usually with ADD, what you're wanting to address is the wandering of attention and the problems with executive function. You're disorganized, you're procrastinating, you're not showing up on time, you're forgetting things, that kind of stuff. And then with OCD, oftentimes that develops as sort of an attempt to compensate. You become sort of maniacally organized. You become hyper attentive to details. You become really extremely fussy about every little detail, about every little, everything being perfectly organized. And then in true OCD, you actually have rituals and intrusive thoughts. I think what you're talking about is probably not true OCD, but if it is, the treatment is the combination of cognitive behavioral therapy and SSRIs, selective serotonin reuptake inhibitors. So meds like Prozac and Zoloft in combination with cognitive behavioral therapy. And then the treatment for ADD is a combination of coaching, education, and stimulant medication, along with whatever else you need. I mean, it's a whole raft of non-medication interventions that you can use. Those do not contradict one another. And the notion of hyper and hypoactivity, I think, is a little bit off base, because the brain is so active all the time. We're talking about what region is active and what region is hypoactive. So I would ignore that description if I were you, and just look at addressing the symptoms that are getting in your way. If it's rituals and too maniacally organized a la OCD, then address that with cognitive behavioral therapy, and if need be, add in medication, usually SSRIs. Obviously consult a doctor. And then with ADD, learn about it, read about it first, understand the positives that go with it, imagination, creativity, inspiration, vision, all of that, and then address whatever's getting in your way, wandering of your mind when you're not interested, disorganization, trouble with planning, and address that with coaching, and if need be, stimulant medication, which you can certainly take in conjunction with SSRIs.
Okay, thank you for that. The next email comes from Tanya. Good afternoon. I recently saw my regular family provider for my ADHD meds, and she asked me how long I planned on taking my ADD medication. That question alarmed me and caught me off guard. I replied as long as I needed it, and I need it to adequately concentrate when I do my job. She replied, because people outgrow ADD, ADHD, and really do not need meds as adults. My question to you is that correct? Should I be off my medication just because I'm an adult and I have probably outgrown it? I disagree, but wanted your professional opinion on this blanket statement that she gave me about adults outgrowing their ADD.
It is absolutely not correct that you outgrow your ADD. That's an old notion left over from a generation ago, and your provider has not kept up with the times. Sometimes people learn to compensate so well that it looks as if they have quote-unquote outgrown it. But most of the time that does not happen, and people continue to take it indefinitely. There is no reason to discontinue your medication as long as it's not causing side effects. You can take it for the rest of your life. Remember, the whole world takes another stimulant called caffeine, and we live in a caffeinated world. I mean, the whole world is on caffeine. So there's no need to discontinue prescription stimulants as long as they're not causing any side effects and as long as they are providing you some benefit. You want to be sure you're seeing a doctor who's supervising you properly and monitoring potential side effects like heart rate and blood pressure. But as long as you're doing that, there's certainly no need to get off of it, and particularly if it's providing you a benefit, don't stop taking it. Your provider is giving you outdated information, and you should be reassured that you can continue to take it safely for as long as it's helping you.
Well, since that one was, you brought up side effects, I'm going to skip ahead. I had an order here, but I'm going to skip ahead to this other email we got. It's quite lengthy, so I'm going to just go over I highlighted some portions here, but she was very concerned about side effects in particular. So she starts off by saying she's been listening to the podcast throughout the day for the last few weeks, and while some have been very helpful, I feel there's two huge areas that need addressing. She says, I'm not an expert. I'm merely a 23-year-old woman who was diagnosed and medicated in the early 2000s and has been navigating the side effects of medication my entire life.
Wait a minute, she's a 23-year-old woman?
Correct.
Who was diagnosed in the early 2000s?
Correct.
So that's 15 years ago?
Yes. She was young, yes.
So she was diagnosed when she was like 8?
8. Mm-hmm.
Okay.
Yep. So she says, I'm writing to urge you to please discuss the following topics on your podcast. And then I'll just list what they are.
Now, wait a minute, sir. I have ADD, so how many of these?
There's like 5 here.
How many of these am I going to have to remember?
5 things. The main thing is side effects.
Well, let me take out my pen
and
I'll write some notes here. Okay.
Let's do this for real.
Okay, so this is what I advise people with ADD to do. Write it down. Okay, so
her first side effect is introducing stimulants to your life regarding, first off, social stigma.
That's a side effect?
She's saying it is. Put a child on medication can be a huge deal for them socially. Sleepovers can be awkward when friends ask, talking, being a kid taking a pill, basically.
Why are you taking a pill? Okay.
Right.
Yep.
Eating. She says when a stimulant is introduced to your life at any age, this will more often than not cause changes in your eating habits.
Okay.
At 23, I'm only now starting to understand what normal and healthy eating look like.
Okay.
Sleeping.
Yep. Okay.
She says goes without saying, but stimulants drastically affect sleep.
Okay.
She's aware that sometimes people with ADHD might have sleep troubles.
Okay.
But she says stimulants make it way worse.
Okay.
2 more. Daily functioning. She says that she's been on this one. I'm going to read a little bit of this. Mm-hmm. I've been on medication since 2004, taking a stimulant of some sort almost every day since the day I started. Mm-hmm. Within the last few years, I've noticed my body is completely dependent on them to function, even at a basic level. A day without any meds means a day in bed. I am constantly, and I really mean 24/7 constantly, fighting fatigue both physically and mentally. I now view the meds as a means to stay awake just enough to get my work done with an hour or 2 of crack mode where I have the energy necessary to do other tasks such as clean my room, write this email, that sort of stuff. Mm-hmm. Nothing is worse than feeling out of control and having someone who clearly isn't invested in your well-being. She's talking about seeing other psychiatrists, not knowing what she's talking about, and that there's a lot of mindless psychiatry out there in her experience. Mm-hmm. Lastly, she says, in quotes, Ritalin kids. There are thousands of us who were put on stimulants in the 90s to early 2000s, and now we are in our 20s, 30s, having been on stimulants our whole life and not knowing who we are or how we function without it. She feels underrepresented in the podcast and what we talk about, and really wants you to talk about this and discuss this. And she says, we aren't people who just got a diagnosis or are starting meds for the first time or who are calling in for their kids. We were those kids not too long ago, and now we are stimulant-dependent adults who need some real guidance.
Well, my goodness, your letter is a sad and poignant example of the misuse of stimulant medication. You've been on stimulants since 2004, so going on 15 years, and it's been mismanaged for 15 years. What can I say? You never should have been allowed to take it for 1 year, let alone 15 years. Just taking them in order. Social stigma, that should have been addressed right away. And as long as you were feeling that, it should have been discontinued. Appetite suppression, if you were losing weight, the medicine should have been discontinued. If you were having sleep problems, the medicine should have been adjusted. And if the sleep problem continued, the medicine should have been discontinued. The fact that you were getting so dependent that you had to struggle to feel normal, medicine should have been discontinued. So you never should have been allowed to continue to take stimulant medication in the face of these side effects. My standard for prescribing is I want target symptom improvement with no side effects other than appetite suppression without any weight loss. And if the child is feeling embarrassed about the medication to the point of having to hide it, I'll stop the medication until I can help that person feel comfortable enough to feel okay about it. To me, the whole experience of taking the medication has to be normalized, and I don't want any of these kinds of side effects. What your letter describes is a terrible misuse of medication, and it's what gives these meds a bad name. I'm really sorry you went through that. Now you're at a point where you need to be gradually weaned off of stimulant medication. You need to work with a doctor who knows what he or she is doing to find another way of coping with life without the medication you were on, so that your system can re-equilibrate, so that whatever has happened to your system can get back to normal, and you can reclaim the kind of vitality you ought to have. This is an example of something that just never should have happened, and I'm really sorry it did. The meds should have been discontinued a long time ago. The proper use of stimulant medication, again, is no side effects, including psychological side effects. Shame, not wanting to take it, feeling embarrassed. No side effects, zero side effects, other than appetite suppression without weight loss. And that's achievable in about 80% of cases. Now, you have to see a doctor who knows what he or she is doing to supervise this. And I'm just really sorry that you were allowed to continue to take it for all these years and have this amount of damage. It shouldn't happen, and I'm terribly sorry that it did happen. For anyone who's listening, that is not what stimulant medication is meant to do. Used properly, stimulant medication can be a tremendous aid, but it has to be used properly. And again, to repeat, the proper use of stimulant medication is to provide target symptom improvement, namely increased focus, increased ability to function in life, get the most out of your brain power. This person's email is a good example of a terrible misuse of stimulant medication.
Thank you for that.
Mm-hmm.
Okay. You mentioned Kristin Seymour in the open when you were talking earlier, so we have an email that really liked that podcast with her as well. Dr. Halliwell, I just want to say how much I enjoyed your recent podcast with Kristin Seymour, so much so that I am listening to it again today. One thing that struck me especially was when you touched on social media and screen time. Before I was diagnosed in January at age 53, I had been on a desperate search to figure myself out, and as part of that process, I took the plunge and deleted my Facebook and Twitter accounts. At the time, I didn't really know why, but I knew it was part of feeling overwhelmed. Too many people to keep track of, too many political and emotional tightropes to walk, too much information all the time. I'm a writer, so at first I thought I couldn't get off social media for professional reasons, but I realized, in fact, I can live offline just fine. It's just a matter of giving up some things for more peace of mind and mental space. While some people with ADHD do seem to thrive on online social connection, I'm guessing there are a lot of other people like me whose daily life would be much, much better by stepping back, maybe further back than they thought they could. While it might not be necessary or desirable for everyone to delete social media accounts, it really is an option. Life goes on. Anyway, thanks so much for your podcasts. They are part of my 2018 project of getting to know myself for the first time after all these years. Signed, Lisa.
Oh, that's wonderful, Lisa. Yeah. And, you know, you don't have to go so far as to delete them, although that's a fine step to take. But just to cut back on your electronic time, whatever it is, what I call screen sucking. The amount of time you spend screen sucking is a big time waste for most people. And if you're one of those many people who feels that you have more to do than time to do it, the quickest way to regain some time is to cut back on your screen sucking, whether it's social media or emailing or even watching TV. If you just cut back on your screen time, you will instantly have more time. And you could even spend that time doing nothing. Doing nothing is time really well spent because your brain is never doing nothing. You can daydream. You can think. Tim Armstrong, who single-handedly turned around AOL, says he did it by mandating what he called 10% think time. And he required his executives to spend 10% of their day thinking. Novel idea, isn't it? 10% of your day thinking. You ask most people, where do you do your best thinking? Most common answer is in the shower. You know, we are in the habit of screen sucking that whenever we have downtime, we instantly screen suck. So, you know, try to recapture the habit of thinking. And a good way to do that is to cut back on screen sucking. So it's a good thing you did. You don't have to give it up, although having a sort of a cleanse, a weekend cleanse, try it sometime. Just spend a weekend without your iPhone, without any screen, without your laptop, without even your television. At first, you'll feel like you're going into withdrawal, and you'll get very irritated with me for even suggesting it. But by come Sunday evening, you'll have noticed a strange sense of tranquility has come over you that you haven't experienced in a long time. I guarantee you it'll happen. It's quite amazing.
That's great. You know, my son just asked me to have one of those days yesterday. He's like, can we have a day, you know, one of these weekends where we do no technology? Like, that sounds great. Okay, I think we have time for one more.
Okay.
This one says, Dear Dr. Halliwell, I regularly listen to your podcast and I love it. Really grateful for you. I am Sher Ali Khan, internal medicine resident PGY2, Weiss Hospital in Chicago. I got diagnosed with ADHD 2 years back. I have a question for you. I take care of 15 to 20 patients on the floor with my 2 interns. My program director and chief residents complained that I cannot handle many patients at a time. They said that I could not keep track of important things, but deep inside, I know that I can do that. Would you please tell me how I can keep better track?
Well, you know, executive function is the thing to master, and I did it as an intern and a resident with a clipboard and a list. Do you still use a clipboard and a list, or is it now on a screen? However, the technology, it comes down to having something outside of your brain, because we ADDers don't have the frontal lobe capacity that other people do. So Whether it's on a screen or on a clipboard with a list, that's what you need to do. You just can't rely on your frontal lobe to do it for you the way other people can. And in fact, nobody can. I mean, as an intern, we all had our clipboards with our list, and every day, we'd go down that list, getting all the scut work done that we had to do. So however you do it, whether you put it on your computer, your iPhone, or your clipboard and your list, that's how to do it. That's how pretty much everyone does it. Don't rely on your memory. Your memory won't do it for you. Your executive function just isn't what it is for other people. That's because you've got other gifts, and your brain is working on your other gifts. And the other obvious thing to do is make sure you're taking the right dose of the right medication. The right dose of the right medication, if it works for you, and it works for about 80% of people, is a lifesaver. It's a game changer. When it works wonders. And so make sure you're seeing a good psychiatrist out there in Chicago. Now that John Walkup is out there, he can refer you to someone. He's a world authority, and he's at Northwestern, and he's the head of child psychiatry there. So you could always call him up and get a referral. Make sure you're on the right dose of the right medication, and rely on a list. However you put that list, whatever medium you use to make that list, and that'll save you. That'll do it for you. And congratulations. By the way, a lot of doctors have ADHD. A lot of my patients are physicians.
Excellent. I think that's all the time we have for questions today.
Well, it's so much fun to have your questions. Please keep sending them in. I love to get them. And by the way, I don't know in advance what you're going to ask, what Sarah's going to ask, what question. So the answers you heard were completely spontaneous, off the top. That's the way I like to respond, and it's fresh for me. So that's it for today. Please remember to subscribe to Distraction on Apple Podcasts BR1 and First, and leave us a review while you're there. As always, send your questions, comments, and show ideas to connect@distractionpodcast.com. That's connect@distractionpodcast.com, or call and leave a voice message at 844-55-CONNECT. That's 844-55-CONNECT. And if you want to win a signed copy of my new memoir, Because I Come From a Crazy Family, The Making of a Psychiatrist, which comes out on June 12th, or a 30-minute phone call with me, this is how you do it. Just go to the Distraction Facebook page, find the pinned post at the top, like it, and then tag a friend in the comments who you think would like the Distraction podcast for your chance to win. I'll say that again. Just go to the Distraction Facebook page, find the pinned post at the top, like it, and then tag a friend in the comments who you think would like the Distraction podcast, and then you get a chance to win. We'll announce the winners next month. And thanks so much, again, for helping us to reach the 1 million downloads milestone. We sure couldn't get here without all of you. Truly, thank you. Distraction is produced by Collisions, the podcast division of CRN International. Collisions, podcasts for curious people. Our audio engineers are the wonderful Greg Sessions, the creative Pat Keogh, and the inimitable Scott Person. And our producer is the unbelievably imaginative Sarah Girton.